As of right now, the law has not changed, none of it. Obamacare, or the Affordable Care Act, continues to be exactly the same, where there is a penalty or potential financial penalty for those who don't have health insurance. The open enrollment period ended on January 31st, and people that can come and purchase private health insurance are only able to do so with a special enrollment situation. So I'm going to talk a little bit about that in the next couple of slides, but I just wanted to start with that because there's still a lot of confusion, and there's a lot of news in the media that are confusing our communities. And I just wanted to start with that because it has been a pretty overwhelming when we're talking to newspapers and radios and doing TV interviews, and the types of questions that we're getting are pretty scary, because people right now think that things are going away and that they don't need to have health insurance. So if there's anything from this presentation today that if you can take back to your communities, whether it's small communities or if you work for a mass media organization, please make sure that your constituents understand that as of right now, the law has not changed any of it. So even if there's a vote, there's nothing going to change for 2017. Those who purchased via Access Health Connecticut from a private perspective, any type of plans, they are going to keep the exact same plan with all the benefits for 2017. So I just wanted to start real quick going into memory lane, because I know that a lot of you have seen these stats in the past, but it's really important to go down and really start with level setting everybody. We are going into our 5th open enrollment, and I have been part of all of them, and I feel like this is going to be probably one of the most difficult ones from a communications perspective. We started the first open enrollment with an 8% uninsured rate in the state, and as you can see, we have been able to decrease this to a current 3.5%. That's great news, but we're not done. There's a lot of people that still need our help, whether it's from a Medicaid perspective, whether it's from a commercial perspective or a private perspective. These people need hand-holding. We all know, like we were saying before, that health insurance is really complicated. And I think that nobody in this room can disagree that this is not news. It has been really complicated, and that we need to help our communities to really understand it. In the past, most of you have asked what the numbers are as far as enrollment. And as you can see from the first open enrollment, when we were able to enroll over 200,000 people, and this is a combination of private health insurance and Medicaid, up to right now 783,543 people. 2016, or the past open enrollment that just ended, had many struggles. Some of them were, we lost 2 insurance carriers. We also had no brokers, in the sense of there were no commissions paid to brokers. And brokers in the past have been vital to really understand and recommend plans to our constituents. In this case, because we knew we were not going to have commissions, we basically engaged with a number of brokers that work directly in our enrollment centers, in our call center, to be able to help our communities. But still, that was not enough. Fewer plans. So from the 2 carriers that were still participating on the exchange, some of the plans were not available. And what that means is, for somebody that chose a specific plan prior year and they just wanted to auto renew, if that plan was not available anymore, they had to come to the exchange and do the process all over again. So just imagine the confusion of, I don't understand, I was set for auto renewal, but now my plan is no longer available. And finally, the big elephant in the room, the presidential election. And again, this, if I can compare the amount of news that we got in 2016 compared to the first open enrollment, it's very similar. There were a lot of media channels talking about the Affordable Care Act, but now in 2016, it was a combination of the Affordable Care Act and the presidential election. So you can only imagine the confusion of trying to tell people that for the 4th open enrollment, they still had to sign up, that there was still a law in place. And still, We got 111,000 people where we thought we were going to get 120, 130,000 people. So yes, it was a great year considering everything, but now we're seeing a lot of people that are trying to come to the exchange saying, oh, I didn't know that Trump Care was not going to start until later, if that's what people are calling it. So as you can see, there's a lot that had to be done in OE4, Open Enrollment number 4. And now we're going to need each and every one of you to help the community understand whether it's immediate changes, and we're going to talk about that a little later, or changes that will come in 2020. So let me give you a little bit more stats around the open enrollment that just ended. Like I said, open enrollment went from November 1st to January 31st, and we were able to enroll in excess of 111,000 people in private health insurance and 672,000 in Medicaid. One of the great things about this open enrollment was that the population that got in our doors for the first time were younger than before. And this has to do a lot with the types of efforts and the platforms that we're using to communicate with younger generations. If I can see hands, how many of you had any interaction with TV ads, radio ads, newspaper, any type of advertisement from Access Health Connecticut last open enrollment? Can I see some hands? So one of the things that I think it's really important to talk about is that we went from telling people that there was a fine, that they needed to enroll, to really focus on value. So it's been 3 years of there is a penalty, you have to hurry up. If you don't do this, there's repercussions. To really start talking about the value of having healthcare coverage and not waiting until you have an accident, not waiting until you're in an emergency room when they're hitting you with a $20,000 bill to go like, oh my God, I should have done this. So a lot of our messaging this time in different platforms was not about enrollments. It was really about value. The other thing is, from an acquisition perspective, we had a great year of people that came to our system for the very first time. So that was in excess of 14,000 people never seen in our system, which means that we're still making an impact in our communities. Retention efforts, considering everything, losing the 2 carriers, no brokers, and losing plans, 78% of the people that we had in our system stayed and now have healthcare coverage. Now, I do have to remind everybody that there are situations that we can't control when it comes to people leaving the exchange. And those can be people that qualify for Medicaid, for Medicare, they leave the state, they get a job, like all these different situations, and around 25% of those reasons are things that we cannot control. Some of them are cost. People find out that even with financial help, they're not able to afford these type of plans. Education. Some of you that have heard me talk in the past about education, that has been a huge priority for me and my team, making sure that we are providing information and education to all of our constituents. We currently have, and where's Kim? Kim, if you can raise your hand. Kim works for Grossman Hines, that has been our community partner for the past 4 years. And they have been working really hard to engage with over 400 community partners around the state, and that list keeps growing. They engage with certified application counselors, with brokers, with community organizations, because we can't do this alone, and I can't stress that enough. We know what we need to do. We know that there's some changes that might be happening, but only you and your communities know how to deliver that message, and that's why it's so important for us to continue that work in the community. Primary care, this is probably one of those great feelings. So in 2015 and 2016, a lot of our efforts were not just focused on getting people enrolled. It's what happens after. You get a plan, you pay your monthly premium, you send your verification documents, you have your ID card, now what? So a lot of this has been pushing different people to go to their annual appointments. This is the very basic and fundamental first step for people to stay healthy. And we were able to get through some research that 80% of our population said that they went to a wellness appointment or a primary care appointment. That's huge. And again, this is just our little effort. Of course, the carriers are also pushing that. So it's just great to see that we're moving the needle in the right direction. Strong branding. From the past 4 years, I think that it's pretty obvious that Access Health Connecticut has been a strong brand and ally. We're not doing everything right, and I say that from a very humble place, and we're trying to make things better every time that we have an interaction with our consumer, whether it's from a system perspective or when we're in front of our communities to help them understand the process. So there's still a lot for us to improve, but this is based on, again, research. We asked some of the people that didn't have any financial help why they came to us versus going directly to a carrier. Why, if they were not getting anything out of it, why did they come to us? And the majority of the people that responded was, because I trust you. I want to be able to have somebody that will be my ally through the process. So again, this is a good result that what our efforts, whether it's in the community or in mass media, that are really working. And again, like I was saying, from a community perspective, we have been working very hard to be able to work with different communities around the state. And this is just an example of some of the great work that we have been doing in the communities. So far we've had around 400 community partners. We were able to create the first of hopefully many community conferences where we had close to 200 people attending. And the reason why we wanted to get everybody in one room was there's so many questions. Some of the community or the certified application counselors have been part of our organization from day one, and they still have a lot of questions, especially in immigration, especially on the enrollment process, especially on the system. So this gave us a good time to talk to all of them and train them or give them additional resources and information. And I'm not going to go into like every single thing that we've done, but one specific thing that I want to talk to you guys about is the naturalization ceremony, especially now more than ever. This is a huge opportunity for us to talk to those that are becoming residents, citizens, and their families that come along. We have been able to be in front of close to 2,000 people during the naturalization ceremonies to talk about Access Health Connecticut and tell their stories about it. Some might not be eligible, but some might. So this is another great opportunity, and talk about misunderstandings of who's eligible and who's not. And I think that last year when I came here, I made it very clear that not only people that hold green cards or are citizens are eligible. There's many other cases where people can come to the exchange. So whenever you have a question about that, it's, if you're a student and you're here with a visa, you're working here with a visa, you're here as a tourist for a longer period of time, all these different situations allow you to come to the exchange. So it's really important for us to not say, well, if you are here and you're just working, you're not eligible. This is just I love maps because it really allows us to look at the amount of help that we have around the state. And as you can see at the bottom, this could be our enrollment centers, our community health centers, our community partners, the Department of Social Services, that are places where people can go and speak to somebody face to face, which is extremely important. So we're starting our whole cycle again. This is very, it's a critical component to what we do every year. Anything that is being done through our community partners start with planning meeting sessions. And this is a good place for people to sit down and tell us the good, the bad, and the ugly. This is a place where they tell us, my community needs X. And we are, through Grossman Heinz and the resources, able to come as a team and decide, how are we going to do this? How can we help? What else can we do? What resources need to be created to be able to, again, deliver the message in a way that your community is going to be able to really be engaged. Aside from that, we have been working with our community partners, providing educational webinars. That is something that is not just around open enrollment, and I want to stress that because open enrollment is just, right now, a 3-month period during the year. And that is just a transactional cycle. After that and before that, there's many important things that need to occur. So I don't know if you guys have read the news lately about almost 10,000 people just in March still owe verification documents. And what this means is the first step to really getting covered is signing up. You go to the website or you go with somebody in our enrollment centers or around the state and you select a plan. That's step number 1. Step number 2, which for some people might be obvious, but it's still, there's a huge gap, is paying the first monthly payment. And I always try to compare this with when you go and buy a car, first thing you do after you select the color, the model, everything is have insurance, whether you use it or not. And so it's really important to remind our constituents that selecting the plan is just the first step. The second step is to pay, and this applies to everybody. Now the third step doesn't apply to everybody, but it's really important, and it goes back to almost 10,000 people just in March alone. If we are not able to verify some of the information that the person included in the application, they need to send physical paperwork. And that paperwork could be verification of income. So if you say that I made X and what we're verifying is Y, we're going to send you several messages saying we need you to send pay stubs or different documents to be able to verify. So just imagine 10,000 people that are still in the queue because they have not sent those documents. If they don't send it after 90 days, they're terminated. So it's so important, again, to remind the constituents, signing up is the first step, paying is the second, and for some of them, if they got any messages from us, to send the verification documents. So talking about resources for a lot of our CACs, our certified application counselors, our brokers, and most of you, we created a specific repository or a website that it's, the address is right there, learn.accesslct.com/community. And this is a place for people to go and get information, get brochures, get whatever it is that you need. And if there's something that you don't see here, we're here to help you out, to hear you out. And again, this is just a place for you to be able to come and get stuff that you can go and talk to your community about. I just wanted to share this because part of what happened at the end of the last open enrollment was there was a campaign called Know Your Value. And what we basically did is we divided our membership into different buckets depending on the type of financial help that they got. And it's easy sometimes to forget that you're paying $50 and without the financial help, you would be paying maybe thousands of dollars. So this was a campaign to let people know that they were saving X amount of dollars in the past year, and it was very well received. People wrote to us and said, "I had no idea that what I was paying was this much versus the financial help that was being provided to me." And so we created a page in the same website, learn.accesslct.com/share, and it was meant to do a couple of things. For anybody that wants to know stats around the state of how many people were enrolled, how many people have financial help, where are they, what do they look like, where are they located, this is a great place. And also, it was meant to be a place where people can go and share their stories. So far, we've had overwhelming amounts of stories, just like this one, where people just tell us, if we didn't have the Affordable Care Act, we would be dead in some cases. In this case, this person that is in his 50s, if he didn't have health insurance, he would have been in a lot of trouble. So it's really nice to hear some of these stories, and of course these have been shared with some of our legislators. It's important for people to hear some of these stories. So last year, I presented this contact information because I know that there's a lot of confusion when it comes to who do I call when I need help. Last year, I communicated that a lot of the CAC or the Certified Application Counselor help was under the marketing umbrella. We just changed that to some of the resources going into the operations side. And so I invited David Lynch, and he's all the way in the back, if you can raise your hand. So David Lynch is your go-to person for anything that has to do with assistance for non-consumer related. So verify enrollment outcomes, proper documentation. We still have Gigi that a lot of you know already when it comes to customer issues. And of course, general questions can go to our enrollment centers. The customer service centers. But I wanted to make sure that at least you could see Dave, that you can meet him. If you have time during the break, go introduce yourself. It's really important to know who to go to and not just try to figure out whether it's just calling somebody that you know. You are after this, you're going to know Dave. Dave has been with the organization since the very beginning, an amazing resource. So I really would like for all of you to meet him. And so let's talk a little bit about looking ahead. So like I said at the very beginning, there's going to be a lot of confusion. There is confusion right now. The most important thing, again, to remind everybody, nothing has changed. If there's an immediate change, it's probably going to affect this open enrollment when it comes to the open enrollment itself. So for the past 3 years, because the first open enrollment was 6 months, but the rest of the open enrollments have been a 3-month period. What is being proposed is to merge those 3 months into 6 weeks. Now, for some people that might be better, but just imagine with the amount of confusion to try to get people to understand that instead of 3 months that they had before, now they only have 6 weeks. So that is, again, something that it's up in the air, but that could be one of the most immediate changes to the law. And again, we are preparing ourselves to every single scenario. Every time there's a version of the new Healthcare Act, we try to sit and start preparing proactively to what we would need to do from a system perspective, from a communications perspective, and most importantly from you guys, the community perspective. How are we going to make sure that nobody's left behind? Now, I want to make sure that I go back to, let's assume nothing changes with the open enrollment. The open enrollment right now is, or has been 3 months. Special enrollment is for those that have qualifying life events, having a kid, adopting a child, getting married, getting divorced, coming to the state. All these different scenarios allow people to come through the exchange outside of the open enrollment period and sign up. But it's not whenever. They have only 60 days after the day of that event. So it's really important if you're coming to the state that you don't wait and not have healthcare coverage until the open enrollment starts. And again, to remind everybody, Medicaid does not have an open enrollment. People can come and go throughout the year. So it's really important to remember those 3 things. So I think from a community perspective, we are preparing ourselves with the worst case scenario, where 6 weeks, where we have to talk to people about potential changes in the 10 health essential benefits, all these different things that need to come, from a communications perspective. So platforms that we're preparing are basically everything you can possibly think of, from mass media to social media to communities to interviews, PR, all these different things to make sure that we're communicating everything as much and as frequent as we can. Simplification of message, and that is definitely something that I want to stress. It's very difficult to talk about healthcare in simplified terms, but it's doable. So a lot of our communications need to go through a lot of departments before they actually go out. They start with the communications person, then it comes to marketing, then if it's data, it goes to the data analytics, and finally it goes to our legal review. Before this is sent to anybody, it's going through a process that allows us to know what the reading level is. And if it's too high, it doesn't go out, because there's way to simplify things. So I would really encourage you, whenever you're talking to somebody, I always tell our staff, don't assume that somebody knows. Don't assume that somebody knows even what the Affordable Care Act is when they know it as Obamacare. Don't think that they know what a co-payment, co-insurance deductible is. Say it with the word, but explain what it is. So the premium, the monthly premium, and sometimes people, all they do is this, they're reassuring you that they have an idea of what you're talking about. Don't assume. It's really important for us to educate, but at the same time inform. So an example of this is, if I'm talking about first step, sign up. Second is pay your monthly premium, also known as your monthly payment. So it's really to start dissecting some of the language to make sure that people understand and not put them on the spot. It's really, we see this on our enrollment centers a lot when we're talking to people and all they do is this. And you think that they're going to be utilizing the benefits to the fullest, and they have absolutely no idea what they bought with who and what to do next. So don't assume people know. And lastly, we're we're up against a lot of uncertainty. Some of the changes might happen right now and some might happen later. So we are going to be working with a lot of our community partners and our certified application counselors to make sure that they understand what's going to impact now. So let's try not to think about 2020 too much when we're talking to our consumers, because that is just going to confuse them more. So I hope that this was helpful, and I'll take any questions. Yes. That's great. Thank you.
Hi, I'm Rhoda McCochie from Statewide Legal Services, the hotline, and I have a question. I really love your share page where people can share their stories about getting Access Health, and that's, I assume, the private insurance. But as I look at it, I see that from the numbers, it's about a 6-to-1 enrollment with Medicaid being a predominant number and proportion of people that you all handle. And so I'm wondering if you have already or are considering having a share page for people to talk about how much it meant to them to get Medicaid and how much of a difference Medicaid has made in their lives.
This page is actually for anybody, and it could be somebody that came to the exchange is not there anymore, or somebody, and we see this a lot, where people go from Medicaid to private insurance, vice versa. This is not meant for just one public or one specific segment of the population. It could be for any of you, of your experience helping somebody, or somebody that, you know, and I think one of the testimonials that we got was from somebody from Medicaid that left the state. So this is meant for everybody. This is a public website for anybody to come. Thank you for the question.
Thank you, Andrea, for the presentation. I really appreciate it. You said something that's very important, that 80% of enrollees sought out primary care. Can you break that down by race and ethnicity? That has not been the case for populations of color. So did you see significant changes and or trends in those populations as well?
Absolutely. Thank you, Pat, for that. I can definitely come back with the breakdown. I think that that is a very important aspect as any of our research, because that is usually the question that we get whenever we get new people in. What do they look like? Where do they live? One thing that I need to remind everybody is that not everybody, because this is not a required field, not everybody includes that information. Or in some cases I can say, well, I'm Hispanic, the rest of my family is not. So sometimes you get a little bit of gray when it comes to results, but I can definitely go back to the raw data and see what information we have. Thank you.
One more, and then we're going to keep going.
Sorry to ask so many questions, but
No, questions are good.
appreciate it. You said that the Learn Access Health webpage has resources on it. So I was wondering, do we go there to find out what the current knowledge is about these changes, or is there another location?
That's a good question. So right now, this is a place or a repository for more educational flyers, brochures, etc. Usually when there's things that belong to like more the legislature, this is not the place to go. Usually there's press releases that go out with that information. So I can definitely send a link to our corporate website where you can go and constantly see the press releases. What I can tell you is that most of it is coming from the Lieutenant Governor's office more than us. So, you know, this is entering into the political arena that it's really out of our what we can and cannot control. So, but there is a website, and the address is, if I'm not mistaken, agency.accesslct.com.